All right, so now I'm going to do the respiratory system and chest. And the trick for draping appropriately, I'm just going to move your hair aside, is taking the patient's gown and tying it in a bow so you can untie it later. Okay, and then what you do, kind of like when you're making hospital corners, you fold back over the shoulders. And now I have a clear view of the back, and they are covered completely. All right, so I'm going to inspect first, and I'm looking at the posterior chest, and I am looking at the skin. The skin is intact. There is a few freckles, no open lesions, and the skin color is mostly consistent throughout, and there are some pigment changes on the shoulders. Okay, the shoulders are symmetrical and the spine is symmetrical, and is in this position it is straight in an anatomical position. Okay, from the posterior view. Okay, the thoracic cage has a you're going to feel my hand, and to one transverse to anterior posterior configuration. All right, I'm going to feel your back a little bit, and what I'm doing is I'm going to check for, let me know if you have any tenderness. Okay, so I'm just checking the back for any tenderness. I'm also checking for lumps. Any pain with this?
No.
All right, patient denies tenderness, and there are no lumps felt. Okay, so I'm going to move on to the thoracic expansion. So I'm going to count down to T10. If you could put your head forward for me, thank you. All right. All right, great. And if you could, when I tell you to take a nice deep breath for me, can you take a deep breath now? And let it go. And again. Wonderful. Okay, so this, the chest expansion was symmetrical as it moved in both directions, about 2 centimeters each direction, which is as expected. Okay, I'm going to percuss. And here I'm hearing dullness. I was hearing resonance all above. And I'm going to come over to the right side. I'm just going to move this up so I can percuss on the skin. Okay. And there's resonance in the right middle lobe. Okay. And I'm going to put a hand down, and you're going to feel me thump your back. Please let me know if you have any pain. Any pain?
No.
Any pain? All right, so patient denies costovertebral angle tenderness, therefore the kidneys are most likely not swollen or enlarged. Okay, so I'm now going to listen to breath sounds. Can you take a deep breath for me? And again. And a deep breath. And again. And again. All right. And there is no adventitious breath sounds. Lung sounds are clear in all three, in both bilateral lobes and the right middle lobe.